Well, hello and welcome to Fistula Fun Friday. Today we're not really going to be talking about fistulas, but we're going to talk about a hip disarticulation, which I hope you enjoy. My name is Marianne Opes, and I'm the complex abdomen specialist at Regions Hospital in St. Paul, Minnesota. And I have a passion for fistula care and complex wounds, negative pressure stuff. And so I started this YouTube channel to kind of show some of the techniques that I use at work in conjunction a lot of times with my wound care nurses. They are wonderful. And today we're going to show you a hip disarticulation and how to place negative pressure wound therapy with Instillation over it. So if you like videos like this, you can hit the subscribe button and then you will be updated if I put out a new video. Otherwise, if you have anything you want to talk to me about or suggestions on anything that we're doing, you can always go to complexwounds.com. And there is an area in there that you can email me. So just some thoughts for that. Okay, so like I said, we're going to do a negative pressure wound therapy system with Instillation in a hip disarticulation of a gal that has had years worth of progressive amputations. She's super sweet and she was very excited about being placed on a video, which I also always appreciate that my patients are more than happy to let me videotape their wound care and help to educate other people. So secret sauce is always important. I love these. These are the 7806 rings Hollister company makes. And when you cut them in a spiral, they cover quite a bit of the wound itself. And then also Cavalon Advance. I mean, this is a new product that's changed everything I do in wound care. It will allow you to put it directly over bleeding skin or abrased skin, and also skin that just is kind of not very healthy. Just gotta allow it about a minute to dry, and it really makes a huge difference when you're trying to land a negative pressure system, especially like around the anus or other places where it can get a little moist or slimy. Another technique tip you're going to see in the video that we're going to show you is taco technique. So sometimes we preload our strips. So you can see here that we're going to put as a picture frame around the wound with the hydrocolloid on. We do this mostly in the OR because we just have a lot of extra hands. The actual taco technique, you're going to put your hydrocolloid all the way down, and you really need to touch it just like this with your fingers so it goes all the way down. If there's any gap at this point, you're likely going to have a seal issue. You can also do it with a preloaded strip like you can see here, but the biggest piece is that right here it needs to be all the way flat. If there's a little bit of hammocking here, I might clip this straight and flatten it out and then add a rectangle piece like this. So there absolutely can't be any escaped air or fluid. Here is our hip disarticulation, and you can see she really needs some negative pressure wound therapy. We cleaned all around the wound, obviously, with Vashe and did Cavalon Advance as well. So we're starting with the easiest part first, which is the top part of it. She usually laid on this side, just like you see her. So we knew her hip was kind of up in the air. She had a lot of redundant skin. So you can see that my buddy is definitely putting it deep into all that redundant skin using the taco technique. And then we're picture framing all the way around with the clear drape hanging into the wound a little bit. And it does a couple of things. It helps to get that seal. But some of these wounds that are really exudative, it's like a little bib and it'll hold the fluid so it doesn't make your barrier strips wet. And then we're adding extra of the waffle dressing in any place where there's any depth to it. And then using our waffle dressing as a pattern so that we can cut the over dressing with that pattern. You can see here, we're making sure that all the edges are nice and sealed, and then the negative pressure seal check is done, and we'll start to instill some fluid. Yeah, you got a perfect seal. There you go. You can see the fluid kind of coming from the bottom side down. This is where we have a lot of discussion about, okay, she likes to lay a little bit more towards her backside. So we put the Instillation up high and negative pressure down low. And so it kind of depends on how your patient likes to lay as to where you put the Instillation and negative pressure ports. So learning points for this video, make sure you gently flatten the peri-wound skin. Having a buddy is so helpful, especially a buddy that knows what they're doing, because a lot of times when you have helpers, they get distracted and they let the skin come back together, and then the hydrocolloid sticks together, then you have to start over. So a lot of times I work with the wound service so that the other person also knows what you're trying to accomplish. Sometimes you just don't have that option. Think about where the patient prefers to position themselves. Do they like to sleep on their side, on their back, that kind of thing? Because then you can have a better idea where to put the installation and negative pressure points. The taco technique is super helpful in the areas where there's redundant soft skin, and having a buddy to help you, like we talked about, is very important as well. Thank you so much for watching. I really appreciate it. I hope that something you saw today will help you in your practice. And if you want, like I said, if you subscribe to our channel, then when we make new videos, we'll send them out to you. And if you have any ideas or anything that you want to see in the future, send it through our complexwounds.com website. And other than that, I hope you have a wonderful Fistula Fun Friday, and we'll see you next time.